Hello, I'm Dr. Nicholas Rogu with AdoptionEducationClasses.com. Today's video lecture is titled Attention and Attachment Issues, a Primer for Adoptive Parents. Attention issues in children. Attention deficit hyperactivity disorder, otherwise known as ADHD, affects roughly 5 to 10% of all children. Some 20%, however, may display a severe form. It does not affect intelligence, and it is not related to mental retardation. Intellectual development, however, is often inconsistent. The child may be ahead in math, but behind in other areas. ADHD is the most common neurobehavioral disorder of childhood. It is likely caused by chemical differences in the brain. Some characteristics include being easily distracted, short attention span, fidgeting constantly, talking without stopping, difficulty with concentration, and trouble with impulse control. The child may become upset when things or people fail to behave accordingly. Children often have mood swings, and their behavior is often unpredictable. Criteria for diagnosis include relying on the observations of parents, family members, and teachers. Behavioral symptoms may be present, and they usually affect more than one setting, such as the home, school, or peer group. Usually, symptoms are present to some degree before the age of 7. They cause clinically significant social, academic, and occupational impairment, and symptoms tend to worsen with increased demand on the child. Growth concerns. Children with ADHD may be shorter than non-affected children, possibly because of treatment with stimulant medication. These height deficits, however, normalize in late adolescence. Is ADHD inherited? Quite possibly. Studies of twins and adopted children indicate that ADHD may be inherited. In managing a child with ADHD, stimulant drugs are frequently used, such as methylphenidate, Ritalin, and many others. There are many approaches to parenting a child with ADHD. One way may be to establish a consistent set of rules, always with the same set of consequences. If the child breaks the rules, it is important that they be reprimanded in some way. You must implement a system of reward and punishments. In evaluating behavioral issues of these children, you must consider the child with problems in school, at home, work, or in social activities for at least 6 months. These problems appear to be related to inattention, hyperactivity, or impulsivity. In this case, an evaluation for ADHD should be done. Symptoms of inattention include failing to pay close attention to detail, making careless mistakes in lessons, difficulty sustaining attention, and not listening when spoken to. They do not follow through on instructions. They fail to finish schoolwork or chores. They have difficulty organizing tasks or activities, and they avoid, dislike, or are reluctant to engage in tasks that require sustained effort. They lose things needed for activities, such as toys, assignments, pencils, and supplies. They are distracted by outside activity, and they are often forgetful in daily activities. Symptoms of hyperactivity also include difficulty playing or engaging in leisurely activities quietly, acting as if on the go, driven by a motor, and also talking excessively. Symptoms of impulsivity include blurting out the answer before being called upon, having difficulty awaiting your turn, interrupting or intruding on others' conversations or games. What does this all mean? The presence of 6 or more symptoms under the category of inattention or hyperactivity and impulsivity may indicate a problem. If they occur frequently, result in impairment, and are not caused by other conditions, this may be ADHD. ADHD and the adopted child. Internationally adopted children have additional risk factors for attentional and behavioral problems. Inattention and overactivity may follow institutional deprivation. Recent thinking suggests that ADHD may be more common among internationally adopted children. It is not yet definitively proven, but many studies are underway. This diagnosis cannot be made without consideration of the time period since adoption. Many recent international adoptees may exhibit this ADHD-like behavior. They may be impulsive, distractible, and inattentive in the months following the adoption. Time is necessary to adjust to their new surroundings, home and school environment. Frequently, comorbid conditions exist, such as learning disability, anxiety or mood disorder, cognitive and memory disturbances. These must be handled separately. Attention problems are the most common reason for school difficulties. Genetic and environmental factors may contribute to ADHD and other behavioral issues in these children. Other conditions that mimic ADHD include emotional disturbances, behavioral disorders, developmental differences, environmental disorders, and medical conditions. In treatment of ADHD, we often use a multimodal approach, which is a combination of behavioral therapy, environmental adjustments, and possibly the addition of medications. The goals of treatment are to decrease the impact of ADHD upon a child's daily function, teach specific coping mechanisms, and teach educators and caregivers effective behavior modification techniques. With this approach, approximately 60 to 90% of children respond to therapy. Improvements have been documented in the areas of attention span, conduct, aggression, social interaction, impulsive behavior, self-control, and academic performance. In the classroom, school staff must be educated about the child's diagnosis and become members of the treatment team. Teachers can be a resource for feedback regarding the child's response to treatment. Combined therapy focuses on the combined use of medication and behavioral treatment. It has been shown to be quite effective in treating children with ADHD. There are advantages over either modality alone. Effects of medication on children must be kept in mind. Motor activity and coordination, cognition, and social behavior are often affected, hopefully in a positive way. In motor activity and coordination, there have been noticed improvements in reduced activity level to normal, improved handwriting and neatness, improved fine motor control. Cognitive effects: reduced distractibility and impulsivity, as well as increased work production and accuracy have been noted in the areas of cognition. Effects on social behavior include reduced off-task behavior in the classroom, improved participation in sports, decreased anger and better self-control, reduced verbal and physical aggression, and reduced defiant and oppositional behavior. In adjusting medications, we must start with a low dose to minimize side effects and slowly work up to the correct dose. Sometimes side effects include decreased appetite or nausea, sleep disturbance, as well as moodiness or agitation. Sometimes a child may appear dazed or withdrawn, irritable or note dizziness, have an increased or development of tics, and suffer growth impairment. In follow-up, a liaison at the school should be identified to comment on the child. They can be the teacher, counselor, nurse, or principal. Dose adjustments can be made weekly. Behavioral improvements and side effects should be discussed. The child can be seen in the doctor's office every 2 to 3 weeks for monitoring. When a stable dose is reached, visits can be less frequently at 1 to 3 months. Modifications in the classroom include changes in a classroom setting to permit the child to reach their fullest potential. Modifications help to teach the child specific coping mechanisms which can be used in the future. In bridging the gap with attentional difficulties, academic performance of the adopted child with ADHD can be improved by using specific, proven classroom techniques. Educators can make appropriate accommodations in school to assist them. Medical therapy, however, may become necessary. What can you do as an adoptive parent? Prospective adoptive parents should find out everything possible about the infant's history, as well as that of the biological parents. This is not always easy. Inherited temperament or mental health conditions can also affect the child's ability to recover from early influences. Insist that social and psychological evaluations be provided and translated. Many families do not receive this information until after the adoption is finalized. Although ADHD can be difficult to treat, today there are many options available. With guidance from experts in the field of ADHD and other behavioral disorders, your child will have a greater chance of reaching their fullest potential. Moving on to the next section, understanding attachment. What is attachment? It is a reciprocal process in which an emotional connection develops between the infant and mother or caretaker. Influences include the following: physical, neurological, cognitive, and psychological development. Attachment forms the basis for trust or mistrust. It shapes how one relates to the world, how to learn from and form lasting relationships throughout our lives. Healthy attachment occurs when the infant experiences a consistent primary caregiver who protects and nurtures them. They provide basic emotional and physical essentials, such as touch, movement, eye contact, smiles, food, shelter, and clothing. Symptoms of poor attachment in the infant include, but are not limited to, weak cry response, rage, resistance to cuddling, poor sucking response, poor eye contact, no smile response at all, indifference to others, sensitivity to touch, constant whining, and lack of tracking. Symptoms in the older child of poor attachment include, but are not limited to, inability for affection, extreme control issues, acting phony, destructive behavior, lacking impulse control, learning delays, unsuccessful relationships, no cause and effect thinking, being very demanding, unusual speech pattern, a personality described as that of Dr. Jekyll and Mr. Hyde, superficially charming, and lack of eye contact or constantly lying. What is in store for this child? The inability to form lasting relationships. They cannot learn to trust. They may grow into distant, manipulative, or uncaring adults. They are unable to parent a child without mistreating them, and sometimes severe reactive attachment disorder and antisocial personality may result. What is reactive attachment disorder? It is the result of several interruptions that occur during the formative period of a child's development. What is the basis for reactive attachment disorder, or RAD? Their ability to attach, trust others, and relate to primary caregivers is negatively affected. The child's ability to bond with or attach to others is greatly determined by what happens between the infant and caregiver during the first few months of life, when the brain is still rapidly developing. What causes RAD? There are many factors: genetic disposition, maternal ambivalence, prenatal trauma, neglect or abuse, abandonment, separation from the mother, inconsistency of caregiver, moving multiple times, institutionalization, birth trauma, painful illness or chronic illness, exposure to drugs and alcohol, and medical conditions which prohibit touch. What is the importance of the caretaker? Relating to an inconsistent caretaker or lacking a nurturing and loving relationship can physically change the child. The wiring of the brain is affected. It may lead to difficulty regulating emotions and inappropriate behavior. What are other effects of RAD? There may be expressions of anger and mistrust, controlling and attention-seeking behavior, and hyperactive behavior. This can result in poor impulse control and a sense of separation. Other conditions. These can be confused with other conduct disorders, such as ADHD and ODD or oppositional defiant disorder. They sometimes can coexist, however. This makes management more difficult. Children can have difficulty accepting comfort and may be either overly affectionate or unable to express affection. Parental experiences. This is a strange situation. One of the most difficult situations for parents to deal with is the disbelief of others outside the family who are exposed only to the child's endearing qualities, which seem to contradict the behaviors encountered in the home. Attachment, a simplified definition. Attachment begins when a parent responds to the child's needs and wants. Over a period of time, the child comes to trust them. They learn to believe that their parents will be the guardians and providers. What is the role of attachment? Later, when they leave their parents for temporary periods or for a prolonged period of time, they carry their idea of protective parents with them. They make use of this when necessary, during periods of insecurity, frustration, and anxiety. This strong foundation empowers young children to face the many challenges throughout their lives. Because a child's initial relationship is with his or her parents, it lays the framework for many of the relationships to follow. Children with a secure attachment background tend to approach others in a positive manner. Since they feel valued by their own parents, they assume others should be valued as well. The notion of attachment reminds us of the child who does not want to be left alone at daycare. They throw a tantrum and they cry when the parent leaves the room. This form of attachment is quite normal and expected at certain times. However, when is this not normal? There are some instances, however, when attachment problems are quite severe and are truly a disorder. In suspecting true attachment disorder, this diagnosis refers to young children who have severely disturbed relationships with others resulting from the poor parenting they may have received. Children with RAD may avoid forming personal relationships. They are known as the inhibited or unattached type. Others may seem overly friendly to everyone. They don't distinguish between parents and strangers. They are known as the uninhibited or indiscriminate type. What is the risk in adopted children? In both cases, there is no real sense of trust. The children treat other people as either threats to be avoided or as targets to be manipulated. Not all children who are adopted from abroad, the so-called post-institutionalized children, are destined to have attachment problems. But the more emotionally and physically deprived they may have been, and the longer they remained in that environment, the greater the risk becomes. Children available for adoption, both domestic and by foreign means, may have faced difficulties early on. These difficulties may take the form of physical, emotional, or sexual abuse, neglect, and multiple placements. They may be more difficult for the child to attach to a new family because of these circumstances. Many adoptive couples face this situation. When this occurs to children within the first few years of life, they can develop the lack of trust that characterizes reactive attachment disorder. A child with this disorder may not be able to open themselves up to love regardless of how loving the adoptive family may be. They have learned from many experiences from previous caregivers that it may not be safe to love. This has become their defense mechanism, a mode of survival, so to speak, that becomes second nature. This is their way of coping with their environment and the people in it. There are some extreme behavioral disturbances noted in adopted children. They are noted more frequently in the setting of international adoptions, usually due to suboptimal or lack of resources of the foreign orphanages. There is a lack of standardization in the adoption process, and it always is in a constant state of change. One such condition is institutional autism. Positive memories of life fade, then the child regresses to an infantile stage of development. There is loss of language with few words. They shriek, moan, yell, and grunt. They rock, sway, pick at themselves, bang their heads, and other behaviors are noted. They have self-stimulating behavior, and this is a means of communication. They fill their gaps of loneliness, boredom, and despair. Regression can be quite severe, and the child may appear mentally deficient. There is loss of growth parameters. The child may appear very young for age. There is also rapid deterioration in behavior. They act out, they play with urine and their feces. Due to nutritional and medical neglect, there may be poor brain and body development, causing deficient memory, learning, and concentration issues. Children with minimal delays may recover over a period of time with adequate family structure, behavioral, and intensive educational interventions. What can you do? Prospective adoptive parents should find out everything possible about the child's history, as well as that of the biological parents. In international adoption settings, this information may be unavailable or difficult to obtain. Inherited temperament or mental health conditions can also affect the child's ability to recover from early experiences. Insist that social and psychological evaluations be provided and translated. Many families do not receive this information until after the adoption is finalized. Potential adoptive parents deserve this information before they make the decision to adopt a particular child. Some issues to be considered. When planning to adopt a child, certain issues should be contemplated. There are many important decisions to be made, often quickly. There are many and sometimes disappointing outcomes along the way. Couples must consider the leap of faith and the possibility of the unknown existing in certain situations. Seek guidance. Contact support groups for adoptive parents for assistance and guidance along the way. Many have been through similar experiences. If your child shows signs of an attachment problem, talk to your child's doctor or visit a specialist in behavior and attachment disorders. Knowledge is power. Prospective parents should become knowledgeable in the adoption process by connecting with others, learning from their experiences, and becoming educated in the general adoption issues. This will provide the necessary foundation for proceeding with the adoption on your terms. Although RAD, reactive attachment disorder, and other conduct disorders can be difficult to treat, the situation can be alleviated with current therapies. With guidance from trained professionals in the field of behavioral disorders, the long-term outlook remains promising. This concludes the presentation. Please move forward to the online quiz portion, and after completion, print out your certification.